Well, there's a mental health crisis facing LGBTQ plus youth in America right now. The Trevor Project, which is a suicide prevention and crisis intervention nonprofit that supports youth in that community, released new data that shows an alarming number of LGBTQ plus young people considering or attempting suicide, and even more who would like to receive mental health services but didn't. CarePlus NJ is working in New Jersey to support this community. And joining me right now is the Senior Director of Trauma Services at CarePlus, Jen Velten. Jen, thanks so much for taking the time to talk with us today. We see some statistics come out of a recent report by the Trevor Project. Again, that is a suicide prevention and crisis intervention nonprofit. Can you talk us through what this report showed that's pretty alarming?
Yes. So the Trevor Project report that we're talking about is the most recent data from 2024, and it shows us a lot of data to be concerned about. So 34% of youth in this survey reported that they seriously considered suicide in the past year, with 10% of those youth saying that they actually made an attempt. And these are youth that are LGBTQ plus. Additionally, we see that 45% of youth wanted mental health care, but encountered barriers in access to health care, whether that was from their home or even in the community. And fewer than 35% of youth found that their home was, in fact, LGBTQ affirming, meaning that it was not a safe space in their home.
And to clarify, Jen, the youth and the statistics that you've cited are LGBTQ youth across the country, yes?
Yes, national data from youth who identify as LGBTQ+.
And so what do you believe are some of the factors contributing to these statistics? I mean, 34% who considered suicide, 10% who attempted it. That's alarming.
Very alarming. So in this survey, it shows that 90% of youth that were surveyed are actually citing that current political issues are really making them feel very unsafe in their schools and their communities and also in their homes. So unfortunately, the changeover politically, nationally, is impacting our young folks' mental health, in particular our LGBTQ plus young folks' mental health.
How has CarePlus, you're with CarePlus NJ, how has CarePlus NJ tried to step into this space to offer resources?
Yeah, so CarePlus NJ, we are a not-for-profit CCBHC, so Certified Community Behavioral Health Center, meaning that we accept Medicaid, Medicare, private insurance. We never want insurance or cost to be a barrier to youth and to families, and that's really important right now as so many families are facing economic hardships, potential loss of healthcare benefits. So we have been increasing our services for all folks, but in particular really paying attention to groups like our LGBTQ plus youth, where we offer tailored services for youth that are experiencing trauma and also identify as LGBTQ plus, as well as group services for them to really grow their support network.
Jen, we know that only 35% say that they live in a home that feels affirming to who they are. For the rest, for the other percentage, how do they access care if they're not in a space where they might have support to get those services?
Yeah, so the Trevor Project is a really great space for youth that might be struggling to access services. It's not going to be the same thing as therapy. However, they do have Trevor Space, which is a safe space that is monitored by employees of the Trevor Project. And that is something online that youth can access, and they can rapidly escape the site. So in the instance that somebody is coming that doesn't approve of them using that site, they can rapidly escape. But in this online forum, they receive support from other LGBTQ plus youth. And again, it is monitored by Trevor Space employees to ensure that folks are being given the number for 988 as example, the National Suicide Hotline, if they're needing that, and really linking them with services in addition to the support of their community.
With just a few seconds left, Jen, what can folks do, whether community leaders, school leaders, or just folks in the community who want to be supportive? What's your message to them?
My message to everyone is look for the helpers, and the helpers really need to be identifiable. So be out there with your attire that shows that you're safe and affirming. Be in all community spaces so folks know that you're there when they need you.
So important that our youth receive support at every level. Jen Velten with CarePlus NJ. Thank you so much, Jen.
Thank you.